Dr. Doug Wyland from the Steadman Hawkins Clinic of the Carolinas. Today we're going to talk about ankle arthritis. What is ankle arthritis? Well, arthritis can sometimes be a scary word. Arth is joint and itis is inflammation. So at one time or another, probably most of us have arthritis in its most generic form. You may have arthritis for one reason or another. It could be because you injured your ankle many years ago and you have joint inflammation now. It could be because you suffered an ankle sprain recently and just can't seem to get through it. Sometimes there's problems such as cartilage wearing out. That's called cartilage degeneration. Sometimes there's joint inflammation from the joint lining. Other times you can have arthritis because a person has gout or rheumatoid arthritis. Another form of arthritis is degenerative arthritis. And yet another form is called post-traumatic arthritis. You probably get the idea. All of these things in combination lead to you coming to see us for your ankle pain, stiffness, and swelling. And it just doesn't seem to improve no matter what you do. When you first come into the Steadman Hawkins Clinic, we'll evaluate your ankle. First of all, let me go through some basic anatomy so that we can have an understanding of what we're talking about. This is the left foot and ankle. The ankle joint is this structure right here, which allows the foot to go up and down. It consists of the talus bone, the fibula bone, and the tibia bone. On the surface of all the joints throughout the body is something called cartilage. It's called articular cartilage. Articular cartilage is like a Teflon coating that can wear down. Sometimes it can fibrillate and go from Teflon coating to like a shag carpet, and sometimes it can just fall apart and delaminate, as if the tile comes off the floor. In any event, if a problem occurs with the articular cartilage, that's called joint wear and tear, and that'll lead to arthritis. When a person has arthritis, oftentimes they'll have trouble with their full range of motion of their ankle. So we'll ask a patient to move their ankle through a range of motion, up and down and side to side. We'll also test the strength around the ankle. In the same capacity, we'll determine if they've lost strength, if they've lost range of motion. We'll determine if when we press the ankle up, if there's any pinching or pain that develops in the front. This could be caused by things such as bone spurs. And we'll determine also when we push the foot down if there's any pinching that occurs in the back or pain that occurs in the front. Oftentimes when a person has arthritis, they have a combination of problems that are causing the pain. We can evaluate that even better with radiographs. First, we'll send you to the X-ray room and ask to get a weight-bearing X-ray of the ankle. When we obtain an X-ray of the ankle in weight-bearing, we can determine the alignment of the ankle, whether or not your heel is out or in will help us to determine where you're bearing most of your weight. We'll also be able to determine with the lateral X-ray, looking from the side, if you have any significant bone spurs in the front of the ankle joint. After we go through your X-rays with you, we'll determine if you have any instability through our evaluation. Most of the time, patients that have arthritis don't have a loose ankle. Instead, they have a tight ankle. Nonetheless, we'll check to make sure your ankle's not too loose. Sometimes we'll discuss obtaining an MRI study of your ankle. If we get an MRI, what we're looking for is to determine if there's specific areas of the cartilage or the bone that are affected by your arthritis. Sometimes a person can develop bone cysts and cartilage loss, and sometimes there can be loose bodies which we can't see on the plain X-ray. After we've obtained all of our information, we'll make a good plan for you. Oftentimes with arthritis, we can treat this non-surgically. Non-surgical treatments, just like the knee or the shoulder or other joints, can consist of a multifaceted approach. First, we want to try to regain range of motion of the joint. It's hard to regain range of motion of the joint unless it's less painful. So we'll recommend anti-inflammatory medications, and sometimes we'll recommend cortisone injections. Cortisone injections can help quite a bit, and they can last anywhere from 4 to 8 weeks or longer. Think of those as a smart bomb for the ankle, where we place an anti-inflammatory agent right in the center of the ankle joint to diminish the pain. If we've performed cortisone injections and we've used anti-inflammatory medications and that hasn't worked, in combination with rehabilitation to try to regain range of motion, and that hasn't worked, sometimes we'll try what we call viscosupplementation, where we inject lubrication type of medications into the joint, and this can be successful. Last but not least will be surgery. Most of the time we can address a lot of the problems inside the ankle arthroscopically through small poke holes in the skin. If we recommend arthroscopy, most likely we're going to be addressing specific problems inside the ankle. Through the poke holes in the front of the joint and in the back of the joint, we'll go into the ankle joint. We'll be able to identify and remove any significant spurring across the front of the ankle. Second, if there's any areas of cartilage that are rough or fibrillate, we'll be able to smooth those up with a procedure we call debridement chondroplasty. That's essentially smoothing up the cartilage inside the ankle. Third, if you have any loose pieces of bone or cartilage that get caught in the ankle and cause a sharp stabbing pain, we'll be able to remove those. Fourth, oftentimes the joint that has arthritis has abundant inflammatory tissue called synovitis. That synovitis is red and inflamed, and we'll use a combination of a shaver and a heat probe to try to remove all the inflammatory tissue from the front of the ankle and also from way back in the back. Last, again, most of the time when a patient has arthritis and they have a stiff ankle causes more shear forces on the surface, so we want to try to regain range of motion. Part of the package that we would perform arthroscopically for your ankle is also to release the tissues across the front and the back of the joint. That's called a capsular release. We do this very carefully because there's important neurologic and vascular structures across the front and the back of the ankle. If we can approach the ankle in this way by removing all the debris, cleaning up all the loose edges, smoothing out the cartilage, and gaining some range of motion by releasing some specific areas of the capsule, oftentimes we can achieve success by improving the range of motion of the ankle, which is the first priority for an arthritic ankle. After surgery, which is arthroscopic and outpatient, patient will go home and they'll be elevated for a couple weeks. Oftentimes we won't allow weight bearing early on. We'll just let the ankle swelling go down. Then we'll get back to starting active range of motion, exercises, and the rehabilitation process is fairly swift. Most of the time after ankle arthroscopy, we are back playing sports in anywhere from 6 to 8 weeks, depending upon the nature of your sport. Hope this has been helpful so that you understand your diagnosis of arthritis and all of the other problems that are related.